So I was 14. I had gotten my period before this. Like, I had maybe had 1 or 2, like, starter periods that were, you know, very, very light flow, like, enough to be like, oh, you got your first period, but not, like, the full experience. And
the full show.
And I was in 8th grade science class, and I started getting, like, really sweaty. I started having full body sweats. My stomach really hurt. I couldn't figure out like what was going on, but I felt like I might have to throw up. And so I asked to go to the bathroom and realized as I was going to stand up, I couldn't stand up all the way. I had to kind of like hunch and waddle like out of the classroom. And I just have a very clear memory of having one hand on like the lockers in the hallway and trying to like walk down the hallway and having to stop and like bend over and wait for the wave of nausea and cramping to pass. And halfway to the bathroom, I just was like, I don't think I'm going to make it to the bathroom. I'm going to go to the nurse's office instead. And the halls were empty. And I was like, I don't know if I can make it. Like, I don't know if I can get there. Just like, how do I move? I had never felt pain this bad. And I had had a friend a few months before who had her appendix out. And I was like, oh, this must be my appendix bursting.
Totally.
And so I had this like fantasy of like, I'm going to get to the nurse's office. She's going to see how much pain I'm in. I'm going to tell her where it hurts. She's going to call an ambulance. I'm going to go get emergency surgery. Like, they're going to tell me what's happening. And then I got to the nurse's office and she asked me a couple questions. I threw up in her bathroom and she was like, oh, are you on your period? And I was like, yeah. She was like, oh, well, then here's a hot water bottle. Like, you can hang out here for a little while, but, like, you have to go back to class eventually. And I was like, what? Like, how? I'm in so much pain. Like, why are you behaving like this is nothing? This is so crazy. And after about an hour of me getting up to throw up every 10 minutes and, like, passing out on her little cot, she called my mom. My mom came and picked me up. I was hyperventilating so much that my hands were like in claws. My mom took me home. My mom had no idea what was going on. She doesn't get bad period pain like this. And so eventually I just passed out. And when I woke up, my cramps were gone. And we all kind of were like, huh, weird. And that was my first time having death cramps.
This is the Culture Study Podcast, and I'm Anne Helen Peterson.
I'm Kate Helen Downey, and I am a podcast producer and horrible period haver.
So, first of all, I'm so thrilled to have a fellow middle name Helen person on this podcast.
Did you also have a great aunt Helen?
Oh, mine was Grandma Helen.
Yes!
So I had a Grandma Anne and a Grandma Helen. So that's where my name came from.
We're carrying the name Helen.
Okay, so back to your story about your first death cramps. It reminds me of when I was in 7th grade. I mistook first a yeast infection for my period and then a UTI for my period. I got those so young because of various antibiotics that I was on.
Yeah. And
I think that I just understood discomfort as like, this must be my period.
Yeah. Oh.
But like, and to me personally, as someone who hasn't had death cramps and hasn't had horrible periods, like that I thought, oh, this is just what's going to happen. I'm just going to feel this way every month for the rest of my life. Yeah. And that was just normal. Right. Yeah. And the way that I had understood what period pain would be like it was so vague. Like it was, you know, you'd read 17 magazine or you'd see a commercial for Midol and it was like, oh, period pain, take these pills and it'll go away.
It's always,
and like, what did that do?
Yeah.
Right?
It's always sort of like, you first of all, you get told so little before you get your period. You get told like you're gonna bleed and it's gonna happen every month and it means you're a woman and also some other stuff might happen. Don't really worry about it. And and
even if you have like progressive feminist moms,
yes,
like, you know,
yes.
like my mom like was very frank about it.
Same.
And I still didn't understand the scope of what a period actually was.
Yeah. Same. No, it does.
I think because it's hard to describe, right?
It is. Well, it's hard to describe, and you don't get it from anywhere else. Like, you don't get information about it. even just like things we get information about as preteens and kids, where it's like you have an idea of what having a boyfriend or a girlfriend is like from watching TV, from Disney movies. Like, you get kind of educated about this stuff, even if you don't know you're getting educated about it. You have some information about like what's normal and what's not normal. And then this thing happens. And in one of my episodes, I talked to my therapist, and she is like, yeah, you basically, the first time you get your period, you get told, like, welcome to Period Club. The first rule of Period Club is we don't talk about Period Club. And, like, that's it. And, and it's...
Right, like, you do things like, in my junior high, you do... This dates me, but I feel like because we're a similar age, you're going to understand it. Sometimes you'd be like, does anyone have a dime for a tampon, like at the lunch table, to try to like gesture towards like your coolness, right? And I remember like before I even really got my period, I'd be like, does anyone have a dime?
Yeah. Yeah.
But I also think like the value, this would never happen because we understand menstrual blood as abject in our society. And thus like there is a taboo on depicting it in any capacity other than, like, the only ways I've seen it depicted are, like, blue dye filling up a tampon, right? Or, like, bright red blood, which is not how it generally manifests.
Right.
Like, the value in one pamphlet or one health book of, like, what spotting looks like.
Yeah.
Do you know what I mean?
I talked to one person for the podcast who was like, I thought I shart myself twice. Like, because I didn't have any idea that period blood could look like that. So I was like, wait, I couldn't have shart myself twice in a day. Like, this must be my period.
But okay, so we did all this wind up and all of this discussion. We haven't even talked about why we're talking about this, which is that you have a fantastic new podcast out. It's called Cramped. So can you tell me a little bit about like the animating thesis and how you decided there's a whole podcast in this?
Yeah. It's a podcast that has been like living in my heart since I started making podcasts about 5 years ago, where this is something I've experienced my whole life. I've been to so many doctors about it. I get severe period pain, and I have since I was 14. It doesn't happen every single month. Sometimes I get regular cramps, and sometimes I get death cramps, and there doesn't seem to be a rhyme or reason as to like what causes it. I've been to so many different doctors, and they've all kind of shrugged at me and been like, dunno, which made me feel like a freak and made me feel like a medical mystery that has no answer. Until I started talking about it with other people, and that wasn't until college. It wasn't until probably the middle of college I started being like, wait, I get horrible period cramps. It also, freshman year, you share, at my college, you shared a bathroom with like 25 people on your floor. So it's like, if I'm in there throwing up for 7 hours a day, like, you're going to notice and we're going to talk about it. But I ended up finding so many other people who had very similar experiences. And that was a real cognitive dissonance for me, because I was like, if all these people that I'm just sort of randomly meeting also get the same thing I get, how can doctors have like no idea what's going on or like nothing to tell me? And that cognitive dissonance just kind of like stewed in there for years and years. I was like trying to figure out what was going on with me. I read about endometriosis and I was like, maybe I have that. I had a bunch of doctors be like, no, it's definitely not endometriosis for various reasons. And so I just had no idea what was going on with me. And so like I would just deal with it as best I could. I kind of cobbled together like a toolbox. I went to the ER a few times for my period pain at different points, with varying levels of effective treatment and total disregard. And so once I like had made a few podcasts and like really gotten on my feet and understood how to make a podcast, I was like, okay, I want to do this. I got a grant to make 10 episodes, and I spent a year researching, going to doctors and specialists and like finally getting a diagnosis, but also doing deep dives into like, why did it take me 22 years to get a diagnosis? Why don't we talk about it? Like, there's the obvious answer, which is like patriarchy and stigma. And it's like, but where exactly does that happen? Where I want to point to it exactly. I want to, like, if we're going to fix it, how would we do that? Where would we attack it? And so I made 10 episodes of a podcast called Cramped.
It's amazing. I was just listening to the one where you talk with your sister about the fact that you rarely talked about it, even with your sister, until like fairly recently.
And my sister's 4.5 years younger, and she also got death cramps from a young age, and yet we didn't talk about it to each other.
Yeah. And then also part of that episode is you talk with your friend who is a data scientist. Yeah. And I just loved the part where they were like, I look at bad data for a living, and this is the worst data I have ever seen.
Yeah, and unfortunately, that's sort of a theme of the podcast.
Right. And I think a lot of people are arriving now at this understanding that we delegitimize or downplay women's pain. Also, there's not a lot of research about women's bodies, but like it all comes to a head in this series. Also, I just have to note that you have a banging podcast theme song.
I know.
That manages to take everything about the show and turn it into like a song that I would listen to if it was on the radio.
And I can take no credit for that. That is by an artist named Farideh, who just posts songs on TikTok, and this song was posted like while I was in pre-production for the podcast, before I had even started thinking about a theme song, and like 20 people sent it to me, and they were like, oh my God, this would be perfect for your podcast. I was like, yup.
Morning sickness, endometriosis, menopause, migraines, PCOS. What's happening to your body? We don't know, because we never really studied the female body. Female body. Say it's all in my head, but the research is quite spotty. No, we've never really studied the female body.
Like, it's like an earworm. Like, it's like in my head.
It was like such a moment of synchronicity of just like, well, I guess that's done. Like...
So the 5 different questions from listeners are going to take us in a bunch of different places. And to start us off, let's hear from Yashasvini.
How do we talk about period pain without slipping into either martyrdom or dismissal? I notice conversations about menstruation often fall into 2 extremes. Period pain is either minimized or brushed off as a normal inconvenience that people should silently endure, or overemphasized in its suffering to the point of martyrdom, where the conversation becomes centered only on pain and endurance. Both can be limiting. Dismissal invalidates lived experience, and martyrdom can reinforce a view of menstruating bodies as inherently broken or burdened. How do we make space for real disruptive pain while also avoiding discourse that defines menstruation solely by that pain? What does honest and compassionate language around period pain sound like, where we can validate people's struggles without trapping them in a story of suffering? I would love to hear your thoughts on how cultural narratives around pain are evolving or not evolving, and what kind of storytelling feels most useful for creating better systems in medicine, education, or work.
I mean, what a question.
I love this question. Any question with the word martyrdom in it is like, yes.
But also, like, I think that you tread this line pretty carefully and interestingly in Cramped. So can you talk a little bit about negotiating those tensions as you were crafting the podcast?
Yeah. So first of all, it's not something that I like explicitly thought about, because it's something I live every day, right? Like I live in a state of like, I'm totally fine now. I'm totally capable. I'm like here. I'm ready to go. I'm excited. And also in some point in the next 4 weeks, I might be in the most pain I've ever felt in my life, totally debilitated, puking for 7 hours at a time, passing out, like completely unable to function. And also sometimes I've like had horrible cramps and had to just suck it up and take a bunch of ibuprofen and go do the thing that I committed to do and get through it. And so you and I know, and question asker, we know that binary, that either women or people with periods are in pain and suffering all the time and like broken, or period pain doesn't exist and everything's fine, that binary is bullshit. Like it doesn't exist. We are all on a spectrum all the time, and where we are on that spectrum changes throughout our life. So like, I think a very similar thing has happened with PMS culturally over the years. Like, I think we can talk about this on two levels of like personal and like large scale cultural. Because on a personal level, it's very easy. We encounter this all the time, right? It's like, yeah, I can be debilitated one day and fine the next day. And both are real and both deserve recognition and support. And I am not defined by the days that I'm in debilitating pain. And, you know, I'm not really defined by the days that I'm normal. Like, I am all of these things and it changes. But that's really hard for us to do. It seems to be really hard for us as humans on a large scale to hold multiple truths at the same time. And it seems to be, especially because there's so little representation. If someone doesn't experience severe period pain themselves, it is very hard for them to imagine a world in which someone is in such severe debilitating pain sometimes and then other times totally fine. And it's because of a normal biological process. That's not to say the pain is normal, but the instigating factor, the thing that seems to be causing the pain, is normal. It's not like you have a tumor and you're in pain. It's like, this is a thing that is normal, but it is causing an abnormal amount of pain. And I think that's really hard for people to understand on a large level. I saw the same thing happen with PMS, where like just in our lifetimes, I feel like there was a wave of like, hey, PMS is real. Like, these hormone fluctuations are real and they affect everything about us, how we sleep, how we feel emotionally, what our skin does, what our hair does. Like, these are
what's going on with your poop.
Yes.
Like, this was a BuzzFeed post while I worked there, was about like someone figuring out like, oh, my digestive system goes haywire. That is part of PMS.
Oh my God. So like hormones dictate everything in our body. Like progesterone, when progesterone dips right before you get your period, that slows down digestion. Like, you can get constipated before your period. And then when the prostaglandins are released, which are the little messengers that tell your uterine muscle to squeeze and push the blood out, those prostaglandins also talk to your large intestine and your colon and tell it to squeeze. And that's why you get period poops. Like, nothing is happening in a vacuum. All of this stuff, everything affects each other.
It's in your body.
Yeah.
Our body is connected.
Yeah.
Like the different like organs are not like out there operating by themselves, like in their own little orbits. Like they're all
even though the medical system treats it that way, treats everything like it's an isolated system. Like, it's not. They're all affecting each other. And so there was this big push of like, yes, hormones are actually real. They're really affecting people in different ways at different phases in your cycle. And if you are feeling irritable or like sleepy or whatever right before your period, like, that's real and people should get it. And it shouldn't be like, you should get support for that. And then that kind of like went too far. Like, people were like, oh, it's real? Okay, so like women aren't real people right before their period. Like, they act crazy, and like it just got taken to the extreme. And then we had to like, culture as at large had to kind of backpedal and be like, no, like, PMS is real, but like, it doesn't actually affect women that much. Like, we can do whatever, we can do anything during our periods. Like, it's not real. And then that kind of led to another extreme of like, PMS isn't real and it's fine and women can do anything. And either way, we're like left with fewer options. We're left with people thinking badly of us. And it's like, can we please just keep two truths at the same time of like, yes, hormones affect us, and also we're still people and we can still do the things we need to do. And if we can't do those things, it's a medical issue that needs to get addressed and taken seriously.
Right. And like, I mean, what you're pointing to too is that a lot of these discussions are very ideological. And like, you point this out in the podcast, but like, you can map this alongside feminism, anti-feminism, push back on feminism, and like choice feminism, like all of these different understandings of what period pain is. Like, my memory in the early 90s is that like PMS was a punchline, right? Like, oh, are you on your period? That sort of understanding. Yeah. So it was visible, but also like ridiculous. And then it was like, I think this is addressing the question. There was this understanding that like, women can work through that pain. Like period pain exists, but it's also something that we can do it all. So if you just try harder, you can like suffer with it.
Right. It seems impossible for us to be at a point where our struggles are visible and not negating our humanity.
Yeah.
And it also
Yeah,
seems
totally.
impossible for our culture at large to keep the idea in their heads that every individual is different. Yes, menstruating people can all get a period, and all of these periods have some things in common, but also are totally different in other ways. And like, I think that's really hard for people to internalize for some reason. And it's really hard to try to fit into a world that has these expectations. I think a way that we combat that is we talk about it more. I mean, that's going to be my answer to everything here is like, we talk about it more on every level, like interpersonally, when someone says, ooh, I have cramps, like I don't feel so good, instead of going like, oh, okay, and moving on with the conversation, whether you have a uterus or not, being like, oh, do you need anything? Like, what are your cramps like? Do they ever get really bad? Like, how, you know, have you always had bad cramps? Like, just the curiosity and the willingness to talk about it is a huge favor to anyone who struggles with this.
Today's episode is sponsored by Mill. I always thought that like, oh, if the food waste decays naturally in our world, then it'll just go to the landfill and decay. But if it's inside of a plastic bag, it's like rotting inside of the plastic bag and like taking up space in landfills, and then it spews out greenhouse gases. Like it's this whole, like, it doesn't do what I thought it did. I wanted to have something to do with all of my food scraps. I've wanted to have that option for a long time. Here on the island, the raccoon problem is so significant, and like where I live, there's just not a good solution on a place to put the enormous amount of vegetable waste that I produce. I was very like wary about looking at all of these online contraptions that promise to do something with your food waste. But then I got a Mill. The Mill food recycler is kind of magic. It's the size of a garbage can, and you can put all sorts of food waste in there, and then you set a time on your app for it to turn on, and it makes this like slight hum, kind of like the air conditioner turning on or something like that. And then while you sleep, it turns all of your food scraps into these like fine grounds. And then you can use the grounds in your garden. Right now they're next to my sweet peas that I'm growing. You can feed them to your chickens, or you can have Mill pick up all of your grounds and then deliver it to small farms for you so that they can grow more food. Really, ultimately, it's not about what you do with your grounds. Like, don't feel like you have to have a garden to have a Mill. It's more about being part of this larger food system that takes these food scraps and then helps other people grow food. It's pretty awesome. But you really have to live with a Mill to get it. You have to have the experience of putting your food in there and making the little noises and then bringing it out to your garden and be like, oh, look at me, just bringing my food scraps into the garden to reinvigorate my plants. And that's why Mill has a risk-free trial. And right now you can get $75 off if you go to mill.com/culture. That's mill.com/culture. The Culture Study Podcast is sponsored by Ancient Nutrition. The human body is an amazing thing. It can repair and grow in ways that are still pushing the limits of what science can explain. Like the other day, I dropped a ski boot on my toe and I thought I would have to amputate it. Not really, but it was just like this incredible bruise. And then I woke up the next morning and it was fine. As you age, your body's natural healing and building processes slow down. It's totally normal, but that doesn't mean that there's nothing you can do about it. A collagen supplement from Ancient Nutrition can make you feel and look your best. I just realized maybe it didn't hurt as much because I've been taking my collagen. I don't know. Ancient Nutrition's mission is to create high-quality supplements that combine the best of ancient wisdom and modern science. Ancient Nutrition's multi-collagen advanced lean supplements contain 10 types of collagen from 10 real food-based sources. Collagen can reduce joint discomfort and improve the look and growth of your skin, hair, and nails. And I really need that right now because I've been breaking my nails all the time, gardening all the time, so I need stronger nails. Plus, Ancient Nutrition's multi-collagen advanced lean is delicious and easy to work into your daily routine because you can mix it into your morning coffee or your favorite smoothie, or you can just drink it with water. And I do think that like my hair feels a little stronger, which is great because as I've gotten older, I've needed more strength to my hair Right now, Ancient Nutrition is offering 25% off your first order when you go to ancientnutrition.com/culture. That's ancientnutrition.com/culture for 25% off your first order. ancientnutrition.com/culture. Okay, our next question is about like the psychic toll of extreme pain, especially extreme pain in periods. This comes from Kayla.
Can you maybe talk about the potential trauma and psychological effects of being a person with period pain? I was told about endometriosis forever ago, but it took 16 years from my first gynecological visit to address my period pain to actually get a diagnosis. I was gaslit pretty much every step of the way. A male doctor in the ER asked me if I was sure it wasn't just gas, while an ovarian cyst was literally bursting inside of me. People say, oh, I get cramps too, and convince you that your pain tolerance is just really low or it's all in your head. It's not normal to go through Super Plus tampons every 2 to 3 hours, but nobody tells you that. I got my symptoms relatively under control thanks to hormonal birth control, which, as a side note, changed my life. But when I have a flare-up, I immediately am transported to a mental state of pain and panic and trauma. So what gives?
So you did a whole episode on medical trauma, so there's a lot to say here. What would you like to start?
Yeah. I mean, first off, I'm so sorry it took you 16 years, Kayla, to get a diagnosis. I can relate. It took me 22 years to get my endometriosis diagnosis. Turns out I had textbook endometriosis. I don't know why so many gynecologists could not see that, didn't Google it.
That's inexplicable to me.
Yeah,
it's
I know.
Crazy.
Welcome to my world, man. Welcome to my world. It is great. You literally scratch the surface on this topic and it's like, oh, I'm sorry. Is this just stupid? And it's like, yeah, it is.
No, like if you go to Reddit and you look at like the endometriosis or like anything related to period pain, like it's just story after story after story. And you're like, how is this not getting through people's heads? Like, how do doctors not understand that?
It's insane. The WHO estimates that 1 in 10 people with uteruses has endometriosis. And you can have endometriosis with no symptoms or no period pain, which can make it very hard to diagnose. But 1 in 10 people with uteruses, how are gynecologists not getting weeks of instruction on a thing that 1/10 of their patients is going to have statistically? I don't know. It's still severely understudied, although a little bit more is happening now. But it's hard to diagnose, partly because where the endometriosis lesions are in your body, in your abdomen, can result in different symptoms. But there's also like really clear indicators like severe period pain, like GI issues. 90% of people with endometriosis have GI issues that get misdiagnosed as Crohn's or IBS or gluten intolerance. And so because of the understudied nature of it, the undertaught nature of it, and how differently it can present in different people, there is an average diagnostic delay of 7 to 10 years. Wow. That's 7 to 10 years from when symptoms start. So when someone, and it's one of the top 20 most painful conditions in the world. So that's 7 to 10 years on average. Clearly, Kayla and I both waited way longer than that of this severe pain before you get a diagnosis and effective treatment.
It reminds me of discussions that I've had with others, especially people who are older than me, about treatment for menopause. And the revelation, and this has been really clearly laid out by various doctors and like culture study comments threads, that part of it is that there is so little instruction in medical school about menopause, right?
Yeah.
And like, so even just the idea, I think that like in our heads, we're like, if there's something that's wrong with a lot of people, then they teach you in medical school how to deal with that thing. And that is not the case.
Nope. Not if you have a uterus.
Revelatory, right?
It's really only true if you're a white man. That is but we are taught that is true. We grow up being like, yeah, the doctor will know what to do. Like they know all this stuff about our bodies that we don't, and it's not true.
Part of the problem is that we don't talk about it. But if you do talk about it, you get gaslit.
Yes.
Oftentimes. So there's a reason why people don't want to talk about it. They're like, if I just talk about my pain, then people are going to be like, oh, well, maybe you have a low pain tolerance, or maybe it's psychosomatic.
I want to address the like medical trauma of it all, because I had a real, so I had a whole episode about medical trauma. I brought on my therapist, who I've been seeing for years, to be a guest on the podcast to talk about medical trauma, because I had a real issue with the term medical trauma. I have obviously been gaslit and like dismissed by doctors and misdiagnosed and mistreated or not diagnosed. But in my head, I was like, medical trauma is when you get a glove left in you after surgery, or you get sexually assaulted by your doctor. Like that's medical trauma. What I have experienced is just like a bad time. And so I asked my therapist about this during this episode of like, what defines medical trauma? Do I have it? And her explanation was really crucial and like totally changed my mind about my experience. So medical neglect and medical gaslighting is also medical trauma, leads to medical trauma. It is, not as dramatic as some of the things I had in my head as medical trauma. But the key with these like less dramatic incidences is that they are repeated over time. And so it is not just if you go to a doctor and they say, yep, you have period pain, like that happens, deal with it, goodbye. That's just a bad time, right? Like that's just a bad doctor, a bad medical appointment. And if that just happened to you once and then you went to a new doctor and you got appropriate care and you were listened to and validated, you wouldn't have medical trauma probably.
Right.
But when it happens over and over and over again, when every doctor you see invalidates your pain, gaslights you, doesn't give you options, and sends you away with ineffective treatment or no treatment, then that leads to trauma, because the absence of appropriate care and gaslighting are abuse. Like that is, if a parent was doing that to you, that would be abuse. Right. And this is someone in a position of authority who you have gone to for help, and they have treated you like this. And so the effects of this kind of medical trauma can be really subtle and really insidious and affect you far more than you ever imagine. Like, I'll speak for myself. I have this idea of trauma that it's like a thing that happened to you once that affects you forever. And like, if you can process that, like one thing that happened to you, you can like fix all your issues. And it's like, no, no, it's more often a pattern. And then your body gets into a pattern, your mind gets into a pattern based on those experiences that are harmful for you. And so what happens with this kind of insidious medical trauma is that you start to invalidate your own experience. You are feeling something, you go for help, you don't have knowledge of, you're saying, I don't know what's happening to me, help me please. And they're saying, nothing's happening to you. You don't, your pain is imaginary, or your pain isn't that bad.
Or everything that's wrong with you would be solved if you just lost weight, right?
Yes,
or if you stopped being so stressed out.
Yes.
Yeah.
Yes, 100%. Like it's either not happening or it's happening and it's your fault. Yeah. And so what that teaches us to do, especially if you're like me and a little straight A student who takes, as a kid, took authority very seriously, it teaches you to ignore your own body, ignore your feelings, ignore your sensations, and disconnect. And that what you're feeling isn't real. And that carries over to a lot of other things. So that kind of medical trauma leads to things you wouldn't necessarily connect. It obviously can lead to avoiding the doctor even when like something totally different from your period is happening. I don't want to go to the doctor for a checkup. I don't want to get my blood pressure taken. I would prefer to avoid the whole thing entirely. When I'm in pain that isn't connected to my period, my first instinct is like, it's not that bad. I can deal with it. When it gets worse, and it's like, ooh, should we go to usually it's my husband saying like, should we take you to the urgent care? Should we go to the doctor? My immediate thought is, they're just going to tell me nothing's wrong. It's going to be expensive and I'm going to get nothing out of it. And so like, I would rather just see what happens. And like, that's maybe okay when we're young and healthy. Like, as we get older, as we get more complicated, medical stuff going on, chronic issues, like, that may not be okay anymore. We may miss major things going on, like cholesterol levels. We may miss blood pressure issues. We may miss things that could be caught early. Cancers. We could miss those, especially people who experience severe period pain are more likely to get diagnosed with a later stage ovarian or cervical cancer because they're not getting pap smears. Because they have experienced dismissal. They might notice something is wrong, but not trust themselves or not trust that a doctor could help with that. So medical trauma affects so many things that, like, I didn't expect it to affect. And it's really, really important, if you feel you have experienced it, even on a mild level, to talk about it, to, work through that. My guest for that episode was Max Gross, who is a trans man who recently had a hysterectomy. He has severe endometriosis along with some other issues and decided to get a hysterectomy partly for the endometriosis, partly for gender reasons, and has had a medical experience that is just one for the books. And we talked about this, and he came out as trans in his mid-20s. And he realized kind of while we were on mic, after I played some of my therapist talking about, like, the ways that we invalidate our own experiences after medical trauma, he was like, hey, I started getting treated this way by doctors when I was about 18. And I think I had an inkling that I might be trans then, but I sure got used to people telling me that I don't know what's going on with my body and I'm not the authority on my body. And so it took me probably an extra few years to come out to, like, believe myself that I was trans. And so it's like things you would not necessarily connect with medical trauma can really be there. Like, and so if you feel like you are experiencing this and this is happening to you, like, I really hope that you can process that in whatever way you need to, whether that's journaling, therapy, like talking about it with your friends, and of course, finding a provider who listens to you, validates you, and works with you to make your quality of life and your health a priority.
Yeah. And sometimes that involves moving to a different place, which is really hard.
Or working with someone outside of your insurance, which sucks and can be expensive. Yeah. And I resisted it literally until last year.
Wow.
But and I had a bunch of money saved that I really wanted to use for something else. And I have spent over $10,000 in the last year on getting a diagnosis, seeing a specialist who's out of network. There are no endometriosis specialists in my insurance network. And that apparently happens quite often because insurance companies don't reimburse endometriosis specialists in the way that they should.
So this next question is kind of like the ultimate getting rid of period pain, and also about how people, I think, like, it really keys into a lot of, like, the gaslighting and not being an authority on your own body, that whole thing. Let's hear from Michelle.
My period pain and generally horrific periods eventually drove me to get a hysterectomy, which was an amazing improvement to my quality of life. 100% no regrets about uterus. But in conversations with other people with uteruses, I've discovered it's often incredibly difficult to get a surgeon to agree to a hysterectomy, even when it's definitely indicated. In fact, I was worried my surgeon would not agree to it. Why the gatekeeping? Is this just more patriarchal nonsense?
So I've heard this a lot. Why is it so hard to get a hysterectomy?
Yeah. Okay. Well, I mean, short answer, yeah, it's patriarchal nonsense. Longer answer, it seems like, and this is entirely anecdotal, this is not based on any research I've seen, but based on stories I have heard, it seems like if you want a hysterectomy, it's very hard to get one. If you don't want a hysterectomy, it is often, your doctors will tell you it's the only option, you have to have one.
Yeah.
And that is not true. So hysterectomies can be a really touchy subject because, especially in, like, the history of gynecology, which is racist and horrible and bloody. In the history of gynecology, many, many women, but specifically and especially Black women, were often told, this is what's wrong with you and you have to get a hysterectomy. It's the only cure. And that is partly because of eugenics. So it is a really, really touchy subject. There are doctors out there who will tell you you need a hysterectomy for fibroids or endometriosis, that is the only cure. There is some truth to that for adenomyosis, which is kind of endometriosis's nasty sister, where cells that are similar to the lining of your uterus end up growing inside the muscle of the uterus. And so it leads to like an enlarged uterus, really, really painful periods, often very heavy bleeding. And that can be cured by having a hysterectomy. And that is a big choice for someone to make, and that it is absolutely a choice that should be made with full informed consent. I have heard so many stories from people who know they want to have a hysterectomy, know they don't want kids, are very clear about that, and they have doctors who say, well, what if you change your mind later? What if you want kids in the future? Like, I don't feel comfortable recommending this surgery or giving you this surgery, which is total bullshit. And it is
total bullshit.
It's 100% patriarchal nonsense where we are not trusted to make decisions about our own bodies. On the other hand,
again, like reproductive capacity. You're like, no,
Yes.
I don't want kids. Listen to me.
Yeah.
Or if I do want kids, I'll find another way to have kids,
Exactly.
because there are many other ways to have kids.
Exactly. And actually, my quality of life is more important to me than my ability to have kids.
Yeah.
But on the flip side of that, there are doctors who, if you have endometriosis or you're struggling with another kind of period pain, they might say, well, the only option is to have a hysterectomy. And that is not true. Like,
And they're like laying it out as in like, either you have this massive surgery or you deal with it.
Yeah, exactly.
And, like, you
And-
should deal with it.
and the heartbreaking part is a lot of people take their doctor's word, have a hysterectomy for endometriosis, and then find that it doesn't help the pain because often endometriosis is outside the uterus. That's kind of the whole deal with endometriosis is it's outside the uterus. And so taking the uterus out doesn't actually change the pain that you're in. Even though you're not bleeding, you are still having cyclical monthly pain because the hormone fluctuations are activating the endometriosis lesions and causing a ton of inflammation, even though you're not having a period. And so hysterectomies are a really difficult topic sometimes. Whenever people want to talk about like patriarchal nonsense within medicine and like informed consent, especially around medical procedures, I always like to talk about at one point in the late 1800s, breast cancer was kind of identified. They figured out like what breast cancer was, and they didn't understand how people got it, why they developed it, and I think we still don't. But they were recommending that if someone has breast cancer, they don't tell anyone about it because they were so convinced that women were getting worried and anxious and hysterical about breast cancer, and that's what caused breast cancer. That like streak of paternalism and like that way of thinking about what is happening in a woman's body, it has gone more underground in medical settings, but it has never really gone away. And I think that is totally present with the hysterectomy conversation, where when they don't want to give you a hysterectomy, even when you have decided it's the right choice for you, they're thinking, well, you don't know if you're going to change your mind in the future. You don't know, like all of these ideas that we are somehow going to make decisions or actions that harm our bodies, like by accident, and that they're protecting us by limiting the information we get about our bodies.
That's such a good point. This episode of Culture Study is brought to you by Graza, my longtime favorite olive oil. It's fresh, it's never blended, and it comes from a single type of olive straight out of Jaén, Spain, where over half the world's olive oil is produced. Graza is single origin. I once read this great profile in the New Yorker, I should link to it, all about how easy it is to take olives from many, many, many different places and then like put a fancy label on it and sell it as fancy olive oil. But single origin is different. That means only one olive from one region, no mysterious blends. That means a traceable, fresher product without mixing any of the lower grade or unknown oils.
Okay, and I have to tell you, about what Bobby made with our Graza the other night.
Okay.
We are working our way through our huge shipments of Rancho Gordo beans.
Same.
And so Bobby made a recipe from Steve Sando's cookbook called Big White Beans with Roasted Peppers and Pepitas. So we have all three kinds of Graza olive oil. So he did the cooking part with the olive oil, but then he used the drizzle to finish it off.
Yeah.
And it was so incredibly good. Like, it was one of those things where I took a bite and just kept being like, oh my gosh, this is so good. I was like, I texted you, I texted my family, and I was like, you have to make these beans.
And I love a big white bean recipe. But it's especially good when the olive oil is good.
Yes. And the drizzle, it's like, it tastes so like light and fresh and almost springy.
Yes. Which is perfect for right now.
Yeah.
We will link to the Steve Sando book and also to Graza, because right now you get 10% off your first order on Graza's site. You can do it for any order that you make, but I personally suggest grabbing the trio because then you get all three of the big squeezy bottles. The sizzle, which is for normal everyday pan frying vegetables or something like that. The frizzle, which is for high heat, like stir frying, that sort of thing. And then the drizzle, which is for the bean recipe, for the big white bean recipe.
It's for your finishing.
For your
I
finishing.
also used the frizzle for my frozen Costco wontons, and it really elevated them.
I love a frozen Costco wonton. So good. So head to graza.co and use culture to get 10% off trio, which includes the sizzle, frizzle, and drizzle, and get to cooking your next chef quality meal. Or to having your husband Bobby cooking you your next chef quality meal. I want to get to these last two questions because they do something that I was really hopeful we could do in this podcast, which is talk about some of the lesser discussed symptoms of period pain.
Yeah.
So this comes from Julia.
Why did no one tell me that the first period after having my Mirena IUD removed would be like the final boss of periods? I got it within a month of removal, but bled nearly 3 times as much as what I now understand to be normal for me, and was in at least 3 times as much pain. When I called my OBGYN out of concern something might be wrong, she very nonchalantly mentioned that this sometimes happens. Why? And why is no one talking about it?
So I want to connect the dots here too to the fact that very few people talk about the amount of pain that a lot of women experience in the insertion process and the removal process.
Yeah.
I think that IUDs have become very normalized, and like our generation of women who have really adopted them in their 20s and 30s, like we are only now really having the discussion about like people said like, oh, this is just so easy. Like, why wouldn't you get this? Right. Mm-hmm. Instead of talking about like what it actually feels like, that there's no discussion of like the pre-medication that you can do, all this sort of thing. Mm-hmm. So maybe we could talk just broadly about this discourse about insertion and removal.
Yes. Okay. IUDs are a huge flashpoint. And again, I think birth control is amazing. Birth control is a huge innovation, and it is one of the greatest innovations in medicine in the last 500 years. And also, it is really important that every person be given all the information that is available in order to make the decision for themselves. Fully informed consent and choice, like to be able to weigh the risks. And absolutely connecting to the last question, there were, oh my God, go look up the birth control hearings from the 1970s. There were congressional hearings in the 1970s because it was discovered that birth control at that time had way higher levels of estrogen than it does now, and it was causing a huge uptick in strokes and blood clots. But women were not being informed of these risks. They were known to doctors, but they were not being informed of these risks when being prescribed birth control. There were these hearings at which no women were slated to speak. It was all men speaking to all male congresspeople. And so activists were going to these congressional hearings in the audience and standing up and being like, hey, do you want to hear from an actual woman who took birth control? Like, do you have any interest? Like, it's insane that you're discussing our best interest and there are no women speaking. And anyway, these hearings and the laws that were passed after them are why anytime you get any prescription, you are given that like pamphlet full of side effects and like information that you don't read anyway. But like,
right.
Because that was the point where it was determined that people have a right to know all the information and possible risks of a medication that they are taking. Before that, you didn't legally have to tell anyone how a medication could potentially affect their body. And so I feel very strongly about this because I also was on a lot of birth controls in my 20s that did not work for me. I got an IUD, was told like, oh, it's just going to be a little bit of cramping to get it inserted. And I was like, whose cramps? My cramps? Like, whose cramps?
Right. That's such a good point, right? Like, it's not an objective measure.
No, and it was incredibly painful. I got LASIK surgery last year, and they offered me a Valium, and I was like, are my eyes going to be numbed for this? And they were like, yeah, but some people get anxious about, like, eye stuff, so do you want a Valium? And I was like, yes, I want a Valium, but why can't I get this before every pap smear? Like, that makes me way more anxious than somebody doing surgery on my eyes, and yet I am never offered a Valium casually in the waiting room, you know?
Yeah.
First and foremost on this topic, I do want to say there are many places now doing local anesthetic for IUD insertions. It's literally lidocaine. Like, they can take a long Q-tip with lidocaine on it, smear it on your cervix before they force it open to stick the IUD in. And yet it is still pretty controversial. There are a lot of places that like refuse to offer it. You can get local anesthetic for IUD insertion, and you should, if you are interested in that, if you are worried about it, you should absolutely call places, say that that's what you want, and find a place that does it.
This actually, I mean, so much of this ties back into these conversations about like martyrdom and pain, suffering, and like that it somehow like suffering through pain makes you a better person or not complaining about pain, right? And I finally found this dentist that I really, really love, a woman who is also an anesthesia nerd, as she describes it to me. And so she told me about how like there is a certain amount of the population that has like a different, like the nerve forks differently in their mouths. And if you have this, then you need more anesthesia.
Yeah.
When you're, like, you need to be numbed more.
Yeah.
And because most people don't know that, right? And it can't be like, they're just like, oh, this is a normal amount of pain to be in while I'm having dental work performed. Right. And she provided me with more anesthesia, and it absolutely transformed, like I was getting a crown done.
Oof.
And it made me think about like, I never complained before because I felt shame about having dental work done in the first place. And I wanted to be a model patient. Right?
Yeah. We are trained. We are trained from such an early age as women to not make our pain anybody else's problem.
Yeah.
To be good. And to be good means to not make anybody's life harder, to not let our needs or experiences interfere with anybody else. And especially, like, that's what the whole taboo against talking about our periods is about. Like, if you think about it for 2 seconds, like, we don't think about it. But if you think about it for 2 seconds, us not talking about our periods hurts us badly. And for reasons I'll get into in a second, like on top of just the basic sharing of information, there's so much information I could have had so much earlier and again, I had a hippie mom who was very open, and that did not exempt her from this taboo, this stigma, this habit, this training. And if we're in severe period pain and we're just downing ibuprofen and going about our day, fulfilling our obligations, not because we want to, but because we're expected to, who does that benefit and who does that hurt? We are trained this way because it makes men's lives easier.
You know, it's funny because you know how like sometimes we like as women we'll joke about a man cold, about how like men are like totally incapacitated by a cold or an illness. And it reminds me that like actually we should be incapacitated sometimes by illness. Yes. And what we're doing is we're making fun of them for not rising to the standard of non-complaining that we have like understood as how we should perform in the world.
Yes, and I think what we're doing is we're saying, I want permission to behave like you. But
I never have that permission.
Exactly.
Right? Okay, we got to make time for this last question because I'm very passionate about more questions and more transparency about butt pain. This comes from Caroline, and Melody's going to read it.
It took me many years to finally look this up, but after experiencing sharp pains again in my butt last month, I found out that it's a common cramp experienced during menstruation called proctalgia fugale. My question is, what are other uncommon or common symptoms that are not talked about related to period and hormone changes? I remember reading My Body books, but it never had any information on this. In fact, I've never heard anyone mention this symptom. I'm approaching menopause age, and I wonder what symptoms beyond hot flashes, bone density, and the other big changes should I be aware about now? And what are some of the better, more comprehensive resources that can prepare me for these changes?
So we had a great thread on Culture Study several months ago, and I'll link it in the show notes, about perimenopause and menopause. And it's one of those things where, like, sometimes it can feel like, oh, we can attribute everything to, like, oh, that's perimenopause. And, like, that's totally true, right? But at the same time, there is a lot of shit that changes and that we just normalize. So let's talk first about periods. So what are some of the lesser known symptoms of periods that you've encountered in your reporting?
Yes. Okay, so butt lightning, as it is, I have heard it informally called.
Butt lightning. I love it.
Butt lightning is, or butthole lightning, depending on where you feel it. I had heard about this for pregnancy, that very often, because the nerves are so stretched in the later stages of pregnancy, that you can feel like you have like lightning going down like your hips, your butt, your pelvis, your crotch. But yes, this can happen during period cramps too. Basically, you have a ton of nerves in there, and when your muscles are like squeezing and wrenching and moving, things are all squeezing in there.
Like your butt is next to your vagina. Yeah! This makes sense.
It totally makes sense. And that is a pretty common experience for when you have period cramps. I think some of the other stuff that isn't often talked about is, something that's never talked about, which isn't technically a period symptom, but it's part of our cycle. Medications affect us differently at different times in our cycle. If you are an ovulating person, for example, I'm on an SSRI, an antidepressant, it works better for me in the first 2 weeks of my cycle, in my follicular phase and ovulatory phase. In my luteal phase, when my estrogen goes way down and my progesterone goes way up, my body produces less serotonin naturally. And SSRIs are serotonin reuptake inhibitors, meaning they're not actually producing serotonin. They're letting you keep more of the serotonin that's already in your system circulating. But I have less serotonin in my system at that time. Technically, a lot of medication should be dosed differently depending on where you are in your cycle. Yeah. But medications are not studied on ovulating people because the hormone fluctuations make it harder, quote unquote, harder to study, which means more expensive. And so even though 51% of the population has a uterus and may be experiencing hormonal shifts month to month, we just don't look at that. And also a lot of medication like antidepressants is taken much more by women. And autoimmune diseases as well are taken by women, but that doesn't mean that it's been studied or tested on women. And so women also have higher rates of adverse reactions to medications, because of course they do, because it hasn't been adequately developed and tested for people with fluctuating hormone levels like that. It might be safe for them generally, but it's not developed for their physiology. So you may notice on your period or during your luteal phase that your medication is not working as well. I think people with ADD and ADHD experience this a lot too, that they're, especially during their luteal phase, their meds may not be giving them the reaction that they are used to.
Is there other stuff in that vein, like just stuff related to, I think, like, it doesn't have to necessarily be perimenopause or menopause, but it could be just like things that you discovered over the course of your research that or just in like knowing things as a person navigating the world that we don't necessarily talk about. One for me that I thought was so interesting that I gleaned from the conversation about perimenopause and menopause is that there is oftentimes these spikes in feelings of like anti-nurturing feelings.
Yeah, fuck it feelings. Yeah.
Yeah, like you're like, no, I don't want to be a nurturing mom right now or
Yeah.
a nurturing person.
Yeah.
Which, you know, like makes sense in terms of like how perimenopause and menopause positions us in our larger life cycle. But I thought that was super interesting.
That's a fun
And,
one.
I
Yeah.
think-
You just
Yeah,
sort of
it's a
don't give a
totally-
shit
it's a fun
anymore.
one.
You're just like, I'm not doing this anymore.
And for me, none of this stuff, like, I never think of it as excuses. I think of it as like better understanding or positioning some of what I'm experiencing. I'm like,
Yeah.
oh, that gives me some more context to understand how my body feels, how my mind feels in this particular moment.
Totally. Yeah, I think a big one that was unexpected for me, when I started learning about this, I'm not currently in perimenopause as far as I know, but I had always assumed your periods slow down as you approach menopause and get like lighter and further apart. And
Yeah, it's just like, oh, it's like backwards aging, right?
yes. And it turns out that's not necessarily true. That may be some people's experience, but perimenopause can also be a time, because of the way the hormones are changing, it can also be a time where your periods get heavier and closer together. Like,
Yeah, like a lot of final boss periods.
yeah. And I had and it's similar to like, I was told a lot when I was younger, oh, your periods will get better when you get older. Your periods will get better once you have a kid. I don't have a kid, so I have not tested that yet, but I've talked to a lot of people who have had a kid and have said, oh, my periods got better. But then a lot of people who had a kid and said, my periods got so much worse. Like, I think there's a lot of misunderstandings and generalizations, and everybody's experience is so different that, like, part of it's frustrating because, like, we want to know exactly what's going to happen to us, right? We want a doctor to be, or somebody to be able to be like, here is what you are going to experience. And part of, you know, being a human and being a person with a uterus is you don't know what's coming. Like, you don't know. Like, you could experience the common things. You could experience one of the many, many rare symptoms or experiences. And you may not know that something is a symptom of something else until you start researching it or you ask a doctor about it and they say, oh, yeah, that can happen. And it is really frustrating. And you certainly can go research it and talk to other people about it. I think people get very frustrated about, like, nobody told me about this. And it's like, okay, did you ask anybody? Like,
Right.
Did you
right.
talk to your mom about how perimenopause and menopause went for her? Have you talked to other women in your family about their experiences with perimenopause, menopause, menstruation? Because they can probably give you a pretty good idea of what your path is going to look like. Maybe not exactly, but, like, they've kind of done it and you have their genes. Your dad's parents, like your dad's mom, your female family on that side of the family, like, you have their genes. So whatever you experience is probably going to be a grab bag from their experiences.
I found this in a discussion that we had in the newsletter about fibroids, that oftentimes once people started asking their parents and grandparents and like extended family about experiences with fibroids, they're like, oh yeah, we all have these.
Yeah.
Right?
Yeah.
Like, it's just like, oh, and no one thought to mention that this is what was coming down the pipe.
Right. Well, and okay, I think I want to, like, go out on this fact, which is for the podcast, I interviewed a bunch of different scientists doing work on period pain. And one of these scientists was a psychologist named Dr. Laura Payne, which is so appropriate, Payne. And she did an experiment where she had teenagers with period pain, teenagers, young adults with period pain, do basically group therapy, where they came in, they had severe period pain, severe dysmenorrhea is the medical term for it. They came in to do group therapy with each other as a group. I think they did 5 sessions over the course of a couple months. They basically they got a little bit of education of, like, prostaglandins cause this cramping. You know, here are some conditions that you can ask your doctor about that might be causing some of your symptoms. But it really was more about getting these people in a room to talk to each other about their experiences.
Yeah.
And they met a few times. These were people who, like, didn't know each other outside of this. And then they went back and asked them about their pain levels for a year afterwards. So they had asked them about their pain levels before they joined the study. And then they asked them, they followed up every month and asked them about their pain levels, they rated their pain lower after these group therapy sessions for a year. And yes, it's a little bit of this like education and coping skills, and like they had more information than they had before, but it's mostly that they had their pain validated by other people who experienced the pain as well. So they were no longer feeling alone and isolated, and they were listened to, they were believed, and they had community around it. And so there is literal scientific evidence. You know, we feel pain through our brains. Like our brains are what is processing these signals and telling us we feel pain. Our brains are social, like we are social creatures. We survive by being in groups of people, right? And so our brains signal more pain when we are alone and isolated. Our brains signal more pain when we don't know what's happening. You know, if we're feeling a pain and we don't know what's causing it, that is more distressing to our brain, and our brain is saying that is going to signal the pain louder because it wants us to pay attention to that pain. It feels threatening. And so that literally makes the pain worse. When we have community around us, that calms the pain signals, because it's like, okay, something's wrong, but there's people around you, they're paying attention to you, you're being validated, you're part of a community, so nothing that bad is going to happen to you. And when we have information about what's happening to us, we don't panic and ramp up those pain signals. So literally talking about our period pain with other people who validate and support us, and potentially also are experiencing the same thing, literally lowers the pain that we feel, that we perceive. And yet we are living in a world that totally stigmatizes the discussion of periods and period pain. So the stigma is literally making our pain worse.
Yeah. That is a great place to end it. And I'm so glad that we got to destigmatize it through this hour and change. If people want to find more of you on the internet, where can they find you?
Yes. So you can go listen to the 10 episodes of Cramped. That's Cramped. Anywhere you get your podcasts. You can find me on Instagram at Kate Helen Downey. And you can find me on TikTok at Kate is Cramped.
Amazing. Thank you so much. Thanks for listening to the Culture Study Podcast. Today, paid subscribers got an Ask Ann Anything segment that's actually all about Melody's recent reading cruise. So if you want to support the show and get that bonus content, head to culturestudypod.substack.com. It's $5 a month or $50 a year, and you'll get ad-free episodes, an exclusive advice time segment, and the weekly discussion threads for each episode. You also get a big discount if you're already a subscriber to the newsletter. So there's a link to that subscription code in the show notes. Be sure to subscribe wherever you get your podcasts. We have so many great episodes in the works, and I promise you don't want to miss any of them. They include one on the crappiness of private equity, one on Katy Perry, where we try to figure out how to have an interesting conversation about her, one on American accents, Texas culture, and Montana culture. If you want to suggest a topic, ask a question about the culture that surrounds you, or submit a question for our subscriber-only advice time segment, go to our Google form at tinyurl.com/culturestudypod or check the show notes for a link. The Culture Study Podcast is produced by me, Anne Helen Peterson, and Melody Rowell. Our music is by Poddington Bear. You can find me on Instagram at Anne Helen Peterson, Melody at Melodious47, and the show at Culture Study Pod.